Hey guys, welcome to my channel. I'm Georgia. If you're new, welcome, and if you're not, welcome back. In today's video, I'm going to show you guys or tell you guys exactly how I do my psych interview or my psych assessment, so it will be easier for you guys if you are going into psych and you have no clue how to do a psych assessment. So if you do want to see this video, make sure you guys go ahead, like the video, share the video, subscribe, and also leave a comment down below. You need to know you're beautiful, you're perfect just like you are. Psych assessment is based on a series of formal and structured psychological and neurological tests and also interview questions or clinical interview questions that are designed to identify behavioral problem, emotional problem, and also learning disabilities. So I have like a lot of stuff right here, like things that I basically wrote down, and I keep them with me so I do not miss like any questions that I need to ask, any important questions that I need to ask. And I'm gonna show you guys exactly like one of my this. I have made this thing where it basically it give you a little bit of rundown about the patient. This is kind of like an S bar that have created, so I'm gonna go over like how to fill it out. Basically, this is what I bring with me when I'm asking the patient the questions, and I'm also going to show you guys how I ask them the questions. So when they arrive on the unit, I basically introduce myself. Hi, my name is Georgia. I'm going to be your nurse for tonight. And you're normally accompanied by a MHT. So you basically tell them this is the MHT that is going to be working with you tonight. I want you to feel as comfortable and as safe as possible. And we're going to bring you in the interview room and we're going to interview you. We're going to tell them exactly what we're going to do. So I'm going to tell them we're going to be asking you a series of questions. We're going to be drawing your blood. We're going to be doing your EKG, and we're going to be doing a body check on you. Right? So after you finish telling them that, you bring them to the interview room. Most of the times they're compliant, they're not compliant. We do have to do like the body check, like that is like mandatory for us to do. And I'm gonna go over like the questions that I ask them. So the first question I normally ask them is, can you tell me a little bit about what brought you here? And they go on and they tell me. And after I ask them that, I ask them, do you have any thoughts of hurting yourself or anyone else right now? And if they do have thoughts of hurting themselves, normally we put them on a one-to-one. Or if they do have thoughts of hurting anyone else, we put them on a one-to-one like right away. Right? So what I normally do is, after I finish asking them those questions, I ask them, are you allergic to anything? And I also ask them, how would you like me to address you? Okay, so those are like 4 questions that I normally ask right away. So after you basically tell them exactly what you're going to do and what is expected, you ask them those questions. What would you like me to call you? What do you identify as? Do you have any thoughts of hurting yourself? What brought you here? And you just let them elaborate as much as possible and ask them open-ended questions, because you don't want to ask them close-ended questions where they're just saying yes or no, yes or no. You want them to talk as much as possible so you can get a feel of that person, and that will help you to determine exactly what led to the situation. Here I just go by systems. And what I do is I normally ask them, like for respiratory, I ask them, do you have any like any respiratory signs and symptoms, any coughing, any sweating at nighttime, any fever. Then I would ask them, do you have asthma? And so I'll ask them, do you have asthma? Do you smoke? And if they say they smoke, I would ask them, how what do you smoke? Because most of the times some people would tell you like they don't smoke a cigarette but they do smoke weed, so you'd ask them, what do you smoke? And or they smoke vape, so you ask them what do they smoke. And then after they tell you, if they tell you they smoke cigarette, you ask them, how many packs of cigarette do you smoke on a normal day, right? And once they tell you that, then you can offer them education about quitting smoking, like, and you can tell them, oh, we provide medication here that will help you to stop smoking, because smoking is not really good. It can lead to lung cancer, and we want you to stay in the best health as possible. So after you do that, you ask them about loss of appetite. You can ask them about heartburn or GERD. So you ask them, so when you eat, when you sit, when you lay, do you lay down right away, or do you have to sit up? Or you ask them, does when after they eat, does the food like come up if they lay down? About pneumonia also, or bronchitis, right? And then after you finish asking them, you can ask them about so we did respiratory, so we can do the head also, where we can ask them, do you suffer from migraine? Do you have any history of mental illness? Does anyone in your family suffer from mental illness? Is this your first time being hospitalized in a mental institution? What was the outcome of their previous hospitalization? If they did say yes, most of the times they do say yes. So you ask them, where were they before? What was the previous outcome? Are they compliant with their medication? And you can ask them like, if the doctor provide them medication, will they take it, right? And then you can go on after you do the head. Right here you do the respiratory, and then you can go ahead and start doing like the GI, where you ask them, do you have any difficulty swallowing or eating food? What is your diet like? You can ask them, are you allergic to any food? Are there any changes in your weight? Are there any unexpected weight loss or unexpected weight gain? Are there any changes in your bowels? And then you can ask them about nausea and vomiting, diarrhea, constipation, when was their last bowel movement? Do you drink? Because you ask them that because you want to figure out if they are prone for liver disease, or do you have liver disease. If they do say that they drink, you can ask them like, what do you drink? Most of the time they'll say beer, and you ask them, how many beers per day do you drink, or how many beers a week do you drink? After you finish doing that, do you have any numbness and tingling sensation, any loss of memory? And then you want to do their orientation, so you want to ask them, do you remember my name? Because you told them before, so you want to ask them like, do you remember my name? So that's a person. Then you would ask them, do you know where you're at currently? And then you can ask them, do you know what year it is, or do you know who is the president of America? And you can also like say words and then ask them to repeat back those words to you also. like like after you ask them some question, then you ask them back like, oh, remember the words, like you say, remember the words that I tell you right now, and you just say a little phrase, and then you ask them a bunch of questions, then you go back to that word and then ask them, or that phrase, and ask them that phrase. and if they do remember, that's really good. Ask them about their sleeping for psych, and like, how is your sleep? How many sleep do you get per night? What's your typical night like? Do you normally get up to go to the bathroom at night? Do you sleep throughout the night? Do you toss and turn or feel reckless throughout the night? And then after you do that, you can do the GU. So you can ask them about your urination pattern. Like, do you often, like, how is your urination pattern? Are you continent or are you incontinent? Can you make it to the bathroom without going on yourself? um how's your bowels like? Then we can ask them about your muscular skeleton. So we ask them, are you in pain right now? And then you ask them about joint pain, stiffness, any rashes on their back, any any deformation of their spine. You can ask them about that. You know, you're gonna see that when you do the body assessment. You can ask them about that. You can ask them about any surgeries that they have done. And then for the integumentary system, you can look at their skin. If there's changes in their skin, any moles, any discoloration, any bruises, cuts, lumps. You can ask them about their breasts. For the endocrine system, we're gonna ask them about diabetes. Are they diabetic or pre-diabetic? Ask them about their thyroid system. Ask them, are you intolerant to cold? Are you intolerant to heat? Um, do you have you seen yourself eating more than normal and you can't gain weight? Or we can also ask them about glasses, if they do wear glasses. Any contact lens, if they do have contact lens, we need to know that so we can get the solution, because most of the times they're in there for like 7 days, or like 5 to 7 days before they get discharged if they're on the acute unit. And then we do the eyes. So we ask them about like eye surgery, any cloudiness in their eyes for glaucoma or cataract, any hearing loss or ringing in the ears, any feeling unbalanced or dizzy when you get up to walk. We can also ask them about their throat, where we ask them about changes in voices, sore throat, any bleeding in the nose, any ear pain, any chest pain, any heart attack, if they ever had a heart attack before. And then we can do the cardiovascular system, where we ask them about the palpitation, like if their heart is beating really fast, what calms them down. So what calms them down, what make, like, when it happens, so what normally happened before that, prior to that, for it to happen. We can ask them about shortness of breath when walking, or just not like getting enough hair when walking. And then we can look at their extremities for any swelling or any discoloration, trying to feel the pulse. And then after that, we can ask them about any eye trouble, any blood pressure problems, or any frequent or chronic cough that they do have. So after we ask them all of those questions, I have this paper, as I told you guys. So when the nurse calls me, I have all of this information, because I try to look up the patient information, because most of the time when you're getting a patient from PES, and PES stand for Psych Emergency Service. So I normally just look up the patient information. So you have patient name, their gender, their allergies, the problem, why they're coming in, right? So I have it right here. the patient name, their allergies, the age, the gender, and then normally write arrival time right here. So when they arrive on the unit and their problem, and then when the nurse give me the S bar, I write it in this little section. And so when I meet them in person now, I ask them all of those questions, but I do ask them this too, like, what do you identify as? Do you have children? Do you have a history of STD? Do you like males, females, or do you like both? Then I do right here where I ask them the orientation, ask them about migraines, blurred vision, tooth pain, shortness of breath. Are they in pain right now? Then I do, are you a smoker? How many cigarettes do you smoke a day? Then I do the heart. How is their skin? Then I go about the illicit drugs. Do you do illicit drugs? Yes or no? And then if they do say yes, I'll ask them like, when did you start it? When was the last time you stopped? So I'll ask them those questions, and then after I finish asking them those questions, we go over the pamphlet, and we also like, so we go over the pamphlet. We have some pamphlet that we actually go over where we do the ROIs. So that is release of information. We do the release of information. We let them sign it because in psych, or yeah, in psych, if there is anyone that calls for that patient, or anyone that needs to know any information about that patient, the patient has to sign an ROI where we can release information to that person. Because if someone calls, we cannot tell them if the patient is there or not. We can go to that patient and tell them, oh, so and so call, do you want to talk to them, or do you want us to talk to them? And if they do say yes, they have to sign the ROI before we can like tell them that the person is there. And then after we do that, we can go over the mass, and we do the mass and washing, their goals for being here, or their goals for being at the hospital. Then we do the advance directive. So we ask them like, do you know what an advance directive is? Most of the time they don't know what an advance directive is. So you explain to them that an advance directive is basically a document that if you become unable to take care of yourself, you appoint someone to make those decisions for you. So if they say they do have it, you can have them initial and sign. And then if they don't have it, we can ask them, do you want us to create one? And we can create one while they're at the hospital. So once that is done, we can go ahead and do the EKG. The EKG is very simple. So it's basically it's like a 12 lead EKG. So you do the American people eat too much, and then after you do that, American people eat too much, you do one on the arm, one on this arm, one on the leg, and one on the other leg, and then you do the EKG, right? After the EKG is finished, you ask them, you tell them that the doctor have ordered some labs, and no. So after the EKG is finished, then you do the body check. So I'm telling you the order that I go in. So after the EKG is finished, you do the body check. You check to make sure that there's no discharges, like there's no abnormalities, and if there is, make sure that you document it on the body mapping. You make sure that you document it on the body mapping. You also do the vital signs. So as they walk in the room, so that's what you do. You do the vital signs. After you do the vital signs, you check their weight, their circumference, their height. your pulse, all of that, all measurements, right? And after all of that is finished, you ask them about drawing labs, and you just basically tell them the doctor orders some labs for you. This is normal protocol. We normally draw labs for everyone that are new admissions, just to check to make sure that you're okay. Most of the time, the labs that they have TSH, they have lipid panel, TSH, lipid panel, syphilis, because syphilis, it can cause psych problem if it's untreated. So they always have TSH, syphilis, lipid panel, and they also have we call it like blood glucose, CBGs. Yeah, CBGs. So they have those fours, and then they'll do some other ones. So sometimes, like if the patient's on lithium and they stop taking it, they do the lithium test. Yeah, so you do that, you draw your blood and stuff. Once that is finished, you can escort the patient outside of that room, and then just orientate the patient to the unit. So basically what I do, I orientate them to the unit, and I tell them where everything is, what time everything, because you know you have rules and stuff like that. So basically tell them the rules, and tell them like what time everything is open, what time everything is closed. Then I normally just bring them to the seclusion room, and I tell them like, this is a seclusion room. We use this as a last resort. We try not to use it. We try to use different methods to de-escalate the situation, talking to the patient. If that does not work, we ask them, we medicate them. And if that does not work and the patient is still fighting staff or being combative, we normally put them in the seclusion room, but we try not to do that, and they understand most of the times once we tell them. And that's it. That I think that's it. Maybe I'm missing some things, I'm not sure, because yeah, I think maybe I'm missing some things, but I'm not sure. If I am though, I'll comment them down below. But that's like a psych. That's like a psych interview, psych eval. That's what we do as nurses, as psych nurses, for a new admission. Those are the questions I normally ask them, and then after we finish doing that and the patient go to their bed, then we have to like just make sure that the labs are not the labs, but all the orders are in, and like everything is like how it's supposed to do. Then we just start doing our charting and documenting everything that's there, you know. And if you do want a video on how to document, I can also make a video about that, because I become like a pro at documenting. Yeah. So if you do want a video about that, we can do that. I can do that for you. And if you do want a copy of this, I could take like a picture of it, and then I can email it to you if you do want that. But thank you guys for watching this video. I hope this video helped you so you can become a better psych nurse. Yeah, so thank you guys for watching, and I'll see you guys in the next video. Bye guys.